this is Alan from Acupuncture Brisbane and Acupuncture Gold Coast, and today in this short video, I'll take a little bit of your time. I would like to talk about degenerative eye disease and specifically retinitis pigmentosa. This is an increasingly common condition. Recently, we have patients coming into clinic regularly with this condition, in as much as I have studied with Dr. Andy Rosenfeld in the United States to develop and understand the methodologies of the most effective in working with retinitis pigmentosa. The lady, let's call her C, has come up from the southwestern suburbs of Sydney, and we work with an intensive program over usually a period of weeks, sometimes two, where we treat patients twice daily, sometimes thrice daily, depending on the patient, the condition and the situation. And it was a very special moment last Friday, in fact, when C said to me with a smile on her face, "You know, Alan, I was sitting down having coffee at the coffee shop this morning, and I saw someone move out of the corner of my eye." And for people unfamiliar with the condition retinitis pigmentosa, you might substitute the term tunnel vision, in as much as it's basically the person looking through their eye without the capacity to have a vision span that picks up that peripheral vision there. So for C, it was a monumentous occasion. We measured the results. We measure the field of vision. Where patients are regularly tested by optometrists and ophthalmologists, so we can actually ascertain the levels of improvement the patient may experience. But the really pressure parts are where it's a subjective improvement, where the patient goes, "Light bulb, what about that? I've just seen something I haven't seen for years." And it's very special because this condition is usually degenerative, meaning the patient becomes increasingly and more increasingly blind. And to have that, to be able to slow down that process and end in situations as with C, to actually help her to have a broader span of vision, what a wonderful way for me to make my way through life, and what a wonderful outcome for C. And that's what I'd like to say about retinitis pigmentosa and using traditional acupuncture. We're getting some really significant form on the board, and I encourage anyone, rather than resigning themselves to their fate, to give it a red hot go, because there is potential to help most people suffering from retinitis pigmentosa. This is Alan from Acupuncture Brisbane and Acupuncture Gold Coast saying goodbye.